Hi guys, and welcome back to my show. Jokes, okay, it's not my show, I'm just a bit nervous, but basically we are here to discuss health and fitness during pregnancy, and I am surrounded by amazing women and experts in their fields to help us discuss some of the topics that come with health and fitness during pregnancy and some of the questions that you have asked us. So I think I'm just going to ask everybody if they can introduce themselves, and then we can then jump into any questions and anything else you had in mind to let all the pregnant mamas out there know.
I'm Coach Roseanne Kamau. I'm a nutrition, fitness, and a wellness coach, and I help busy moms lose fat without dieting. And why I'm so excited to participate in this is we've worked with Tatiana in the past when she had her baby, and now when she got pregnant, she was like, Roseanne, what should I do? I was like, girl, I got something for you. Because the goal is for you to become healthy, and for any mamas out there to just become healthy, not focus about weight loss, but to really now begin to focus on how do I feed my body well as my baby, and I become healthy and have a healthy body and a healthy baby.
All right, so I'm Coach Winnie. I coach functional fitness or CrossFit, and recently I also got my certification in pregnancy and postpartum athleticism. The reason why I decided to get that is just to understand how to train when you're pregnant, and also how to work with your body and how to change your mindset actually. So I'm excited. Thank you, Tatiana, for inviting me. And ladies, I'm really happy to meet you.
Very nice to be with you again.
I am Mama Olive, or Tatiana Karanja, and I'm just really into fitness, and I get questions from everybody on my Instagram on the daily about what I'm doing, what I shouldn't be doing, and I know for every individual it's different, and I don't want to speak on like a level that I don't really, I'm not an expert on anything, so I thought it would be a really good idea to have women who are able to discuss this and give people information that is, very important.
Hi, I'm Sarah. I'm a physiotherapist and I specialize in pelvic health physio. I think I reached out to you, didn't I? You were putting videos of you doing the CrossFit and saying so many people were DMing saying you shouldn't be doing that, it's bad for your baby. Yeah. And I work with a lot of prenatal and postnatal women, and nobody has the right information. If I speak to postnatal women, they say, why did no one tell me this is what I could do, this is what I can do? So I think just getting the information to women and the right information is just so important. So thank you for having us.
So my name is Dr. Kristina Sule. I'm a consultant obstetrician and a general and cosmetic gynecologist. I run my private practice, it's called Alora Medical Practice. And Tatiana, thank you so much for having me. I really appreciate such an amazing group of women. I think there couldn't be a better combination of people to talk about this. And I think what my message would be today is that we really need to be able to make women aware of what is possible, what is actually possible, because it's so scary. And actually, long time ago, women used to be banned from any kind of physical activity when they were pregnant. And the worst thing is that there's so many benefits to keeping healthy during pregnancy, and women need to be aware of them and their limits, and also what is not possible during pregnancy. And I think we're going to be able to discuss all of that today.
Amazing. I think just even going off that, one of the things that I discuss with a lot of people on my Instagram is the fact that their gynecologists just tell them don't do exercise. So when I'm like, I didn't mean to gasp. Yeah, so that's because when I'm asking them why aren't you exercising, I was just told no, and I'm like, well, in my head, I'm just like, we live in a very traditional society, right? So I feel like some people are very old school in that sense. So for me, it's just like, go find another gynecologist. But obviously, I can't tell anybody what to be doing. It's not my place. So even going off that, maybe you can discuss a bit about that, because I know everyone, we just live in a traditional society. So maybe, I don't know, it's the training or...
I did experience that.
Yeah. Oh, really? Your gynecologist said no?
Yeah, but you know how stubborn I am, right?
Yeah.
So I did my research and just kept training. So I think it would also be great for the word to get out there that it's okay to exercise when you're pregnant. So it's good to have you.
So the thing with medicine is this: when we give a professional opinion, we have to have evidence towards it, and so the evidence does exist, and we grade our evidence in the medical field in you know, what is not really the best evidence to what is the very best evidence. And so what isn't really the best evidence is what we call case reports. So like say one woman will say, I weightlifted all through my pregnancy and I was fine. That's not the best level of evidence, because that's just one person. Now we have better and better and better evidence, where the highest level is what we call systematic reviews and meta-analysis. And the funniest thing is that there are systematic reviews and there are meta-analysis that say health is very important in pregnancy. Fitness is very important in pregnancy. And they say that it's important to start fitness whether you had a sedentary pregnancy all along and now you want to start, that's actually not a problem. Whether you had a previously sedentary lifestyle, whether you had an active lifestyle, that it's beneficial at any point in pregnancy. The only issue is at what level are you going to do this? And that's the most important part. So if you are a weightlifter and you want to continue weightlifting during pregnancy, then yes, that is possible. You may have to reduce maybe the weights, you may have to reduce the reps, you may have to reduce a number of things, but you actually can continue with that. So initiating health and fitness in pregnancy needs to be done at the very beginning, but even if it's not, for whatever reason, maybe lack of information or fear or whatever, then it can actually be started at any point, as long as you progressively start it and that you're safe and that your gynecologist is monitoring you frequently to know. Because I get patients who are like, look, I was doing this and I want to continue it. And some of them, I'll look at them and I'll say, yeah, you can continue. And then some I'll be like, absolutely not, because of certain conditions within the pregnancy. And of course, I know women want to really go and do it hard and just like go all the way and all that.
These women right here.
And there are many like them. However, what happens during very strenuous exercise is that your body starts to diverge blood into your muscles to be able to sustain that crazy activity that you're trying to achieve. And where does it take that blood from? The fetal placental unit. So the baby ends up suffering. They don't get that. And especially if this is something you've never done before. Now, if this is something you've done before, your body is always used to divulging blood to the muscles.
Strenuous for one person,
it's not strenuous for somebody else. Exactly. So if you've never been active, don't wake up and say, okay, today I'm going to be an Olympian. That's not going to happen.
I mean, that even in itself does not, you know, for anybody who is wanting to become healthy, if you've been sedentary and then suddenly you want to pick up an activity, you always want to start slow. And then gradually build yourself up. But this whole idea of women not acting on their bodies is actually going to harm them long term. Studies do show if you're not active, you're actually aging faster. And so can you imagine now you're even now pregnant, and then now you're not even moving your body, guess what's going to happen? You're beginning to age a little bit faster. So yes, it's important that women actually do start moving.
And we have actual medical risks that are associated with a sedentary pregnancy. Like we have deep venous thrombosis, which is very dangerous in pregnancy. I mean, we have obesity, and obesity will then lead to, you know, big babies, preeclampsia, and sleep apnea, and hypertension, and gestational diabetes. Like it's actually really serious. You need to move during your pregnancy. You cannot be sedentary.
The evidence is there behind
the evidence, and it's strong evidence. It's not like there's one lady somewhere who got
that.
This is like literally studies of thousands of women that have been shown to be sedentary versus active, and the differences in their pregnancies and outcome of their deliveries is night and day.
It is night and day.
Sure.
It is night and day.
I think one, going off now, what you can be doing, there was one question that we got about somebody trying to climb Mount Kenya, was it? So, and there was another question of what you absolutely cannot do while you're pregnant, and I think that's one thing you said, that you want to tell people, maybe not climb a mountain when you're pregnant.
Maybe climb a mountain when you're not pregnant. Because altitude, I mean, there's research on exercising at altitude, and they're saying the safe kind of zone is 1,800 to 2,000 meters, so, or 2,500. But a lot of the evidence, a lot of the research has been done on people who live at sea level, then coming to somewhere, you know, at altitude like Nairobi, and exercising. There's actually not much research and evidence behind people who live at this altitude. Like people who live in E10 or somewhere, and then, but I think until that research is done, climbing Mount Kenya in the second trimester is not a good idea. It's strenuous exercise, and you have lower levels of oxygen, so it's not.
So I'd also put that in, when you're pregnant, you also, would like to change your mindset also changes. So such things, you'd be like, would I really want to do it right now when I'm pregnant? Because you can put it on hold and do it after. There's no rush in it. Yeah, so you just have to go through your pregnancy, then think of that later. You don't have to do it now.
But I think now that you're talking about mindset, I've also found it very difficult. Like when I'm in the gym and I can't do something, and I'm just like, obviously I know I'm pregnant, and I know my body's doing a lot, but mentally it's been really challenging sometimes when I'm in there and I can't manage to finish the workout, or I can't do the same weight that I did like a month before, and that has been really difficult for me to kind of change that mindset and be like, it's okay, I'll be back next year whenever my body's ready. That has been very challenging for me, definitely.
And I think it would be, think about it, Tatiana, and any other woman that's pregnant, you're carrying an extra baby, so do not, and that's extra weight, right? There's also the stresses of being a mother. You already have other children. Having a baby in your body, that in itself is a different type of stressor. And so moving from either being a single mom or being a mom who never, or being pregnant yet you never lived that lifestyle, your lifestyle's beginning to change. That in itself is stressful. I remember when I had my kids, my first daughter, and she was so easy. But that transition was really difficult and stressful. And so this is where moms, we have to give ourselves grace. You cannot do it all. You have to understand what season are you in now, and understand how much can I move in this season? What can I do? What is the bare minimum that I could do that makes me feel good? I've taken care of my body, but also recognizing all these other issues that are going on. I have to take care of the kids. Maybe you're a working mom. There's all these other different, it's like competing things in life that are pulling you. And so it's where you now begin to almost, this is one thing I coach and I tell my clients, it's where you begin to put your boundaries and you decide what's going to be important for me. What can I handle now? Because with you, and I know how competitive you are, that in itself makes you feel like, maybe I'm not doing well. No, you already are. You gotta give yourself grace, and you have to.
And then the other thing that, especially in the gym, and I totally get it, how you're feeling right now, what I tell my clients is that the gym will always be there, and you can always come back, build up your strength, and you're going to come back stronger, because now you have strength for like 3 people. So please take it easy. You'll always come back. CrossFit Quit will always be there. It's not going to go anywhere. So if you feel like, okay, I cannot do 3 rounds of this workout, 1 is fine, 2 is fine. You've done your best, you've given it your best, you're good to go.
The mountain climbing, I wouldn't advise in any trimester, honestly. The first nurse, second, not third.
The mountain, climbing, not the exercise, but the climbing the mountain. Got it. Okay.
Doing the entire mountain.
Okay.
Honestly, no.
And what other exercise? The question was actually also what exercises are a complete no during pregnancy. So if there are anything else that...
So, systematic reviews and the ones that I spoke about usually say that the best exercise during pregnancy is aerobic exercise, which means we're talking about cardio. So we want your heart pumping, we want good circulation, and that is really the best. And anything that leads to cardio. And so that includes swimming, that includes yoga, that includes walking. Now, funnily enough, the systematic reviews say that anything that is strenuous, anything that leaves you, there's the talk test, like you can't talk through that workout, is a no in pregnancy. So if you cannot continue talking during your workout, that exercise is a no for you. And you see, everybody has a different level of fitness. So if you're gonna swim 2 laps and then all of a sudden you can't even breathe, then that's a no for you, as much as swimming is a good thing in pregnancy. So that could be weightlifting, that could be long runs, because you don't want oxygen being divulged away from your baby, and that's the most important thing. You should be able to talk through your exercise, it should be comfortable, you should be able to take your heartbeat maybe up to 130, maybe not more than that. You should avoid hypoglycemia during your workout. You should try and keep hydrated during your workout, because all of these things are things that affect the baby. It may not affect the baby in one workout, but several months down the line, now you find, okay, this baby isn't really growing very well because they don't really get enough oxygen throughout consistently. So for me, it's usually anything that takes your heart rate above 130, anything you can't talk through, for me that's a no.
So
wouldn't you?
Sorry.
It's okay. I was going to say, wouldn't you say that's going to also be individual? Because when I think of what there's I was going to say there's individual. She's a runner. She does 800 meters. I forget her name. She's Olympic winner in 800 meters. And she ran when she was pregnant. You've watched her, Yes. And so one of the things I know they're also saying, and maybe correct me if I'm wrong, because weightlifting is sort of like a newer thing, especially with women. So I would assume studies maybe, or longitudinal studies are not out yet. I don't know.
But they do also say strength training alongside your aerobic training is important.
Yes.
Yeah.
It's
Yeah.
a mixture of...
So
It
like I
is.
wanted to
It
ask,
is.
I've been an athlete for the past 8 years and weightlifting. I compete in weightlifting. So something like that, how would you advise as a doctor to...
So you see, you guys are the extremes.
Mm.
You guys are not every other woman who's there.
Yes, yeah.
So there's the woman who's not doing any activity at all, and then there's the one who's weightlifting and running. I mean, an athlete who can do 800 meters is not every other woman.
Yeah,
That's
true.
not
It's
so for regular women, honestly,
Yeah.
it's a no. And the
Okay.
studies I'm quoting are like 2020 studies, so they're
Okay.
fairly new, and they're they're not like 1980 studies. Yeah.
Okay.
And so if this is something you've never done, that's definitely a no. If this is something that you feel is straining you and the evidence is being seen on ultrasounds, on the way you finish your
Yeah,
workout,
true.
Yeah.
on the way you're exhausted, on the way you can't keep up with anything, then
Right.
honestly it's a no. And unfortunately, health and fitness is a very relative thing to talk about in pregnancy. There are some women who literally cannot even take a 30-minute walk.
Yeah,
correct?
true.
And
That's
then there are
true.
those
Very
who
true.
can feel absolutely fine and they never even feel pregnant until maybe the last 2-3 days, right? So it's a very relative thing. So I would say, for this discussion to benefit more people, we need to talk about the regular woman, the woman who's not an athlete, but also not just sitting at home the entire day. Yeah, she has things to
Brilliant,
do,
yeah.
and that's a woman who needs to be encouraged to push herself a little bit more, so that she can get a little bit healthier in her pregnancy. You know, not just like stay where she was,
Yeah.
but like you do need to increase your activity.
Yeah.
That's what I
And
would
there's-
say. I know it's an ambiguous answer, but like
No, it
I think
makes
that's
sense.
very
But it
easy to
makes sense.
understand,
Yeah.
And you have to do it in at a safe level for you. If you weren't exercising before,
Yeah.
there's always a way. There's a way to start. You know, for some people, strenuous exercise would be weightlifting. For some people, it would be walking down the street.
Yeah,
Exactly.
true.
So it's having somebody to guide you and
you.
sort of say,
Yeah.
this is the level you're at. And of course, you
Exactly.
can
Let's start
progress
from
it.
Exactly.
But
And-
if people just
sorry.
say, no exercise, then
Yeah.
you don't do anything.
And I prefer the person who guides you is actually a fitness expert, because many times a patient comes to me and they're like, so doc, I want to do 20 push-ups. Like, I don't know. I'm not really
I know,
alone.
right?
You have no idea what your
You don't have
fitness
any
level
history of
is.
fitness
Like
level.
if you like drop down in my office and did them, I'd be like, okay, let's see. So I feel like it needs to be a fitness expert.
Yeah.
And then
Really,
I'm
yeah.
going to be able to monitor you and tell you like, okay, look, your baby is actually managing this, your back is
Yeah.
managing this,
Yeah.
your pelvis is managing this,
Yeah.
and so you can continue. But if I feel like, okay, no, something here is off, they'll be like, okay, can you and your fitness expert please, take
Dial
a
it
step
down.
back.
Yeah.
Dial it down.
Yeah.
Dial it down.
So the other thing, sorry,
so
the
no, no,
exercises that you're saying that we should avoid, contact, of course.
Yes,
Oh,
contact
yes.
sports
Mm.
out,
And
yeah.
then anything that's has
Give
the risk of you
examples,
falling.
yeah. Let's
so
give examples of
rugby,
contact
you know, if
sports,
you're
yeah.
playing
Yeah.
rugby,
Yeah.
of course, it's out of the
Rugby,
things,
boxing,
yeah,
football,
boxing,
basketball
yeah, all
as
those things
well,
that have
yeah.
contact, and then also something that will make you fall. Box jumps sometimes,
Yes.
such things.
Because
Going up a rope, climbing up a rope,
Yeah.
please,
Yeah. Any risk
and
of
coming-
falling and your center of balance
Yes.
changes.
Is off.
Yeah.
Yeah.
So when
Yeah.
you're doing things that are more risk of falling,
Yeah,
Yeah.
exactly.
it's just not worth it.
So-
Talking about risk of falling though, like there's people who do like yoga inversions, right? But it's something that they've been doing their entire career. So I know I've seen that they get a lot of negative feedback because, they shouldn't be inverted, but at the end of the day they're so used to being upside down and like holding like and they know how to fall. Whereas somebody who like you're just everyday woman doesn't know how to do that exercise, so shouldn't be
Yeah.
performing that. Or is it also just a no?
I don't know about
I would say a
inversion from
no
your-
for me,
Yeah.
because of the blood supply to the baby,
brilliant.
but also the idea of knowing how to fall. Well, you don't really know how to fall
Yeah,
when you're
when you're-
pregnant, do you?
The
Like,
center,
What's-
I know I
what
did
part
that
of your
handstand.
abdomen are you gonna choose
know,
to
I
fall
did.
on? And you get it's like
Yeah.
when you're not pregnant, you can choose to fall on, like your side or whatever, and you're not gonna get injured because
Yeah.
you've done this
Yeah.
severely. But when you're pregnant, you actually never know how you're going to fall. Your center of gravity is
It's off.
completely
Yeah.
It's
off.
off.
It's
Yeah.
completely
Interesting.
off.
I'm
And
gonna try it.
where
Little
would you
cartoon.
fall?
I'm guilty of that.
It's like I wouldn't want
I
my
am
pregnant
guilty.
patient to fall in any position, whether it's on her side,
No,
back,
but what I
front,
mean
like,
is, like, when you're doing a handstand in CrossFit, you learn how to fall on your feet,
Yeah,
right?
yeah.
I mean, there's a
I
certain
know
way
what
that
you
you
mean.
fall.
So Tatiana, I'm
Yeah.
gonna go back
Yeah.
to that.
So I know
I'm
for
guilty.
me.
I did handstands when I was pregnant, but again, mindset. You got to change that, because also you never know when you're falling and how you're going to fall. And the center of gravity has also changed.
Yes.
So you want to, so I had to also, again, we go
Tell
back
yourself.
to changing your mindset. Yeah.
Is
You
it
can
worth
always
taking
come,
that
it's
risk?
not
That's
worth
the thing.
it.
It's like if you don't do
Yeah.
this inversion during your pregnancy, is that the end of the world? Like you immediately you give birth, like
You're
right
back.
out of delivery room. I'm gonna let you go.
Handstands, let's go. You know, the thing I think we want to do is really think about functional movement.
Yeah.
The things that we're talking about for the average woman, what are the things that they do at home
Yeah.
that is using their body
Yeah.
that they can enhance and improve? So
True.
things, so let's not even look at handstands or the inversions, but let's think
Yeah.
about things like squatting. Right? That is a
Deadlifts.
normal
Yeah.
movement.
Yeah.
It's the most functional movement. Literally, you see how we have those pit latrines when we go to showers?
Yeah.
Those are
yeah.
the best latrines for human body,
That's
because
true.
when you're supposed to be sitting in a squat position, and it actually helps push things in your digestive tract to
Yeah, to
move
go
and
down.
flow nicely. So we need to consider the movements that we're talking about are simple functional things that you're doing on an everyday. You're lunging. A lunge is one of those where you're moving forward and you pick up something on the floor. We're not supposed to use our back, right? Because you're gonna break your back. Like even a normal healthy person, use your quad. So it's like doing the simple lunges, doing
Deadlifts,
the
yeah.
deadlifts,
Yeah.
doing the squats.
Yeah.
Those are the types of walking, swimming if you have a pool.
Functional.
Things that are easy on your joints,
Yeah.
that are not going to give you so much stress, but are going to keep you in that state of activity.
Sure.
And building upper body strength as well. That's
Yes,
often forgotten.
definitely.
And then people are carrying a baby for
Yes.
however many
Exactly.
hours a day. Their
Yeah.
baby's getting heavier.
Yeah.
So actually building upper body and back strength is super, super important.
Yeah.
But also in terms of the way you say about the functional exercises, for me, I feel like if you're going to do exercises, yes, they're to help you, get healthy, stay healthy, avoid obesity, avoid other medical problems in pregnancy, but also I feel like they're so important to prepare you for labor. Women who are active during their pregnancies are so much better in labor. They are more cooperative.
True.
They are, it's just an easier labor. It's honestly even faster. And I'm not
The
saying
actual
that
like pushing part.
Yes.
but even the actual
Even the-
labor, even
oh.
way before you're pushing,
Oh.
like it progresses at a good pace. Of course, there are many obstetric things that can stop you from having a normal delivery and you're not having a cesarean, and that exists for those who are active and sedentary. However, for a healthy pregnancy that has no issues, no obstetric issues, women who are more active have a much better labor than women who are sedentary. Their labor is slower. Their labor is very difficult. Like you can tell this labor is stressing them. It's stressing the baby. So activity is really, really important. Yeah, especially for first-time moms.
Especially
Before I forget on that point, when I was doing my study, just you exercising also doesn't mean that you're gonna have a natural birth or a cesarean. So don't go to the gym saying that I'm going to the gym so that I can have a natural birth, because you never know what happens.
Stress me.
Yeah.
Go to the gym, therefore we're not having a cesarean.
You said
I saw you on that.
I saw
If
it.
I work out, I'm gonna have a vagina. I didn't say that.
So that's something we need to correct out
Yeah.
there on how people perceive fitness and the type of birth they're gonna have.
Yeah.
And I know that we moved away from weightlifting, but there was a specific question for you about weightlifting on your pelvic floor.
Yes, so someone's saying, how do you prevent straining when you're lifting weights? Which I think is a really, really common question. For this, and I mean, we talked about this earlier, listening to your body and knowing your body. For pelvic floor issues, it's you have to be aware of your pelvic floor, know how to engage your pelvic floor, which the majority of people don't, because it's something we don't think about, we're not taught about. So actually having sort of pelvic floor therapy when you're pregnant and understanding your body, actually, and like we said, listening to your body. You can listen to your body if you know your body. And when you lift something heavy, be that weightlifting or you're lifting a heavy box, often what you do is you hold your breath to try and get a bit more strength. When you're holding your breath, usually that pressure is sort of dissipated equally. If you have a pelvic floor issue or a pelvic floor weakness, that pressure can then sort of go down into the pelvic floor. So for people that are lifting with the sort of the breath holding, a lot of people call it Valsalva Technique, where you're
bracing.
you're bracing. And bracing is a good word because you have to be bracing everywhere.
Yeah.
You have to be able to brace your pelvic floor to then lift.
I'm trying to do that.
So it's really difficult when people, when someone says to you, engage your pelvic floor, everyone's like, okay,
What
maybe
is
it's
that?
it's and unless you have somebody assess you, which you can only assess internally if you're engaging your pelvic floor. And I think a lot of the time we've talked about this before, Kegels is always any pelvic floor issue. Everyone says you have to do your Kegels, and that's it.
Could you explain what Kegels are?
So Kegels are just a pelvic floor contraction.
Which is what? Like, take
Sir,
us through. Like, what should I do?
let me just take you like way back,
Yeah.
because I've had so many clients, when you tell them about the pelvic floor, have no idea what you're talking about. So just
Okay.
maybe explain to them what pelvic floor is,
Yes.
and then we.
Yeah, so your pelvic floor is a group of muscles that sit in your pelvis. They make the floor of your pelvis. So there's 3 different layers of your pelvic floor muscles. They have a few different functions. They support your pelvic organs. They keep you continent. They're important for sexual function. They're important for stability. And stability is often the one where people are like, what do you mean?
For what?
Yeah.
I know, right? I just thought that. For
What are
what?
you talking about? Because often, if you say to someone, where is your core? Often people just think about
The abs, yeah.
And that's it.
Yeah.
Core exercises, sit-ups, this
Yeah,
is all
yeah.
focused on just abs.
Mm-hmm.
But actually you have to think about your core as the whole of your body here.
Yeah.
Yeah.
So your diaphragm sits at the top,
Yeah.
then your ab muscles are the front,
And then
your
the,
pelvic floor is the bottom,
Yeah.
and your back muscles are the back.
exactly.
That's
So when you do anything that increases your intra-abdominal pressure, and that's lifting, just going about your daily life,
Mhm.
all of those 4 systems have to work together to maintain that pressure.
True.
If they're not working in sync, or if you have a weakness, then when you increase that pressure, say you're lifting something heavy, the pressure will go where there's least resistance. If you've got a pelvic floor issue, the pressure will go down.
Yeah.
If you have diastasis
Yeah.
and you're not maintaining that pressure, the pressure will go here.
Yes.
So a lot of the time for pelvic floor, sort of at the beginning, it's learning how to engage your pelvic floor.
Yeah.
It's doing it with your breathing, because your diaphragm and your pelvic floor are antagonistic muscles, so they work in the opposite
Mhm.
Yeah.
direction. As you take a breath in,
Yeah.
your diaphragm contracts and moves down.
Yeah.
Your pelvic floor actually relaxes to move that space.
I remember
Yeah.
this balloon activity in
Yeah.
school.
Yeah.
Yeah.
Exactly.
Yes.
So they move down, and then as you breathe out,
They
your
come in.
diaphragm moves up and your
Yeah.
pelvic floor
Comes
contracts.
in, Yeah.
And for a lot of people, breathing is also something I teach people all the time.
Oh yeah, I
Yes.
do that
Because
as well.
women will
Yeah.
always talk, breathe in, make yourself look skinny.
Yeah.
People pull their stomach in.
Yes.
Yeah.
But actually, when you breathe in, your stomach should be
should
relaxed
become
and you should be
yeah.
able to move.
Yeah. So I use
So-
that when training. Actually, I tell people, imagine you're blowing into a balloon and you're breathing in, the balloon goes out, expands, yeah, and then when you're breathing out, it goes back in.
Because so many people, then if you suck in your tummy, stuck in your abs, you then get a bit of contraction of your pelvic floor.
Yeah.
So it becomes a very dysfunctional relationship.
Yeah. True.
So when you say
Yeah.
we do Kegel exercises, what are we supposed to be doing?
So
Like Roseanne was just like, yo, Kegel.
I mean, no, because she said, because she's explained the pelvic floor.
Yeah.
Now, and she talked about Kegel.
Yeah.
So Kegels are, if you think about your pelvic floor, they're a contraction of your pelvic floor.
Yeah.
The best cue they've actually done studies on this, and the best cues for contracting your pelvic floor is, imagine that you're in a lift full of people and you need to fart and you don't want to fart. That gentle squeeze, that gentle lift is your
That's
pelvic floor.
boom,
Yeah.
boom. There you
And
go.
people,
Such a good one.
Yeah, it is. It's so good. It's
Everyone's been in
relatable.
that situation.
Yeah.
And then relaxing your pelvic floor, you just think about, when you've got out the lift and you're tired,
You just
you're
release.
Relaxing that fart is relaxing your pelvic floor. It's something so simple. And often when I see women, they're trying to do their Kegels and they think it should be this super big, strong contraction.
No.
So then they're squeezing their glutes,
Yeah.
they're sucking in their stomach.
Yeah.
It's a very, very subtle contraction. And having that control is key for all the exercises you're going to do, but especially for that if you're lifting something heavy.
Yeah.
It's, if you think about when you're on the plane and you take that breath in, you hold your nose and you're trying to equalize your ears.
Yeah.
If you aren't contracting your pelvic floor, then that pressure will push down.
Yeah. True.
So it's something to postnatally, you have to be in control of your pelvic floor and know that you are.
Yeah.
So actually being assessed by somebody assessing your pelvic floor, we often do assessments not only sort of laying down, but with movement and standing,
Yeah.
because they're the positions in which there's more strain on it.
Yeah.
I'd like to add something to the pelvic floor strength, as much as this isn't specifically health and fitness in pregnancy, but a lot of women, and Kegels are good, and I'm very much for Kegels. However, Kegels sometimes are not sufficient for certain kinds of women who develop really bad pelvic floor and vaginal laxity because maybe they've had several deliveries, they never attended to their pelvic floor and laxity in between deliveries. Maybe they're on their 5th, their 6th, maybe they had really big babies,
Yeah.
really terrible tears during their vaginal deliveries that had to be repaired, maybe were not repaired very well, and so eventually they get a lot of pelvic floor issues and vaginal laxity. So Kegels are good. The damage is so bad that the Kegels are actually not going to do anything for you. That you actually need a surgery to correct that pelvic floor. It's completely damaged, completely torn, muscles completely loose. Vaginal laxity, like I get some patients that, I'm doing a vaginal exam and I tell them, okay, can you please do one Kegel for me just as I'm examining you? And they're like, well, I'm doing it. And I'm like, it's not there. So you really need to do more of them, but also seriously for some patients who have had very bad obstetric histories, they need to consider either, a vaginal perineoplasty or radiofrequency vaginal tightening, because that will improve their urinary function, their sexual function. It may not improve much of the things inside the abdomen, right? But for the pelvic floor, it will definitely like cause a lot of improvement. So that's something that some people need to consider.
Can I ask? So I know I coach older women, slightly older, let's say 40s and 50s, and one of the things that they've said is that element of feeling like, especially when they're doing jump ropes, I gotta go to the bathroom, or I can't do jump ropes because. So what happens there?
So what happens is that the pelvic floor gets damaged with age and menopause, because you see, estrogen also gives us continence. It keeps the pelvic floor really intact. So when you go into menopause and estrogen starts to decline, you get something called stress urinary incontinence. So if you jump or lift or something, you just find inadvertently a little bit of pee escaped, which you did not intend, but that's because the angle between the urethra and the bladder has been altered either by lack of estrogen or by several vaginal deliveries. And so we do have non-surgical solutions to that, which are fantastic. And then when the incontinence is really bad, meaning that if you have to go, you have to go, and your entire bladder will empty whether you like it or not. So for that, there's surgery. All right. So we have different kinds of incontinence, either urge or stress, and those can be brought about by vaginal deliveries or by aging. And in the non-surgical methods, we have several machines. Like for example, we have the something called an Emsella, which isn't available in Kenya but is available in the West. And what it does is that it does for you 11,000 Kegels in 30 minutes.
Oh, wow.
Nobody's going to do that.
11,000 compared to 3,000.
I know, right?
And so that's fantastic, because within a month and 2-3 sessions, you have better pelvic floor strength. It contracts the muscles for you. You literally just sit like this and it's doing them for you. So there's a difference between improving your pelvic floor and vaginal laxity. Those are two very different things. You can have an intact pelvic floor but have vaginal laxity and vice versa. And so then when you see your doctor, they'll be able to tell you this is what you need. You just need maybe vaginal tightening, you need an actual pelvic floor repair, or you need a non-surgical pelvic floor strengthening. And so all these options are available, because, and of course I love that we talk about Kegels, because these options are not available to everyone. There's anyone who can't afford any of this. And the best thing that a woman like that can do is actually Kegels. That's what's going to help you.
That, but also not Kegels are not the only sort of
solution.
I see people who are told to do Kegels, and that's it. That's where the kind of advice stops. But actually strengthening, doing squats, doing lunges, anything that you're strengthening your core, everything
works
is
together,
then helping to strengthen your pelvic floor. And actually, for all the women, for everybody, having that information before all of this happens, and knowing, what you can do preemptively to strengthen, puts you in a better position when you're then either, having a baby or when you reach menopause. The stronger you are, the better control you have now, and the more you work on it now, puts you in a better position when you get to that age. But the machines that do your 11,000 Kegels, as long as they are, you see someone who is trained first. Because there is one here, there's a pelvic floor chair thing here, and you can basically just go yourself. You don't have to have any kind of assessment.
That's crazy.
You can
you
go.
have to be assessed.
Which, there's certain types of incontinence which are caused by your pelvic floor being too tight. So
like an overactive bladder.
If you have an overactive pelvic floor and then you go and sit on a chair that does 18,000 Kegels for you, it's going to make your life so much worse. So seeing somebody before, and for Kegels have their time and their place, but as long as they are prescribed by the right person.
True.
Because there's a whole host of other pelvic floor issues that come with an overactive pelvic floor. And for that, it's like thinking, imagine your bicep is stuck here, and then you're going to do bicep curls. So you have to be assessed by the right person, because those treatments are complete polar opposites.
I completely
wow.
agree.
We go through a lot.